In this video, we're going to document the process for a specialist, or any medical provider for that matter, to document a medical problem and add it to the patient's problem list. We will also then go over the method for them removing it from the problem list but adding it to the patient's past medical history for historical purposes, as well as documenting any surgical or procedural intervention which may have been performed. In this example, I'm going to give this patient a diagnosis of gallstones. I search for it. I'm going to choose this one. Notice that once I've added it, there's this box that says PL. PL means problem list. So if I check this, then it will remain on the problem list forever or until another provider goes ahead and removes it. In this case, I'm assuming the role of a general surgeon who's seeing a patient in consultation for gallstones. I've seen them at the visit. I've documented that they have gallstones. I can also at this moment make some diagnostic specific notes. If I click on this box, a new window will open, and now I can write the information. In this case, I've quickly added some information showing that the ultrasound documented the gallstones, and we're going to do a laparoscopic cholecystectomy the next week. And this information will stay on there. Now, I've added this. It's on the problem list as well as my office visit. Now, I haven't done the rest of this problem or assess the other problems in this note, but I'm going to go ahead and lock it. Yes, this is an incomplete note, but that's okay. Now, I'm going to go to the patient's office visit today, which is here. This is a new office visit, so let's imagine that I have now seen this patient, I've done their laparoscopic cholecystectomy, and now I need to update this in their chart. I'm going to go back here, and I can find the problem list, and I can add gallstones. Now I can document any information that I might need to. Notice I still have my ultrasound notes here, and I can add more information. And I'm going to click OK. Now I'm going to close this, and I still need to do two things. This patient no longer has gallstones, so this is no longer an active medical problem for this patient, and I don't want it on their problem list. But I do want the historical information available showing that they were treated for gallstones and that they had the surgery. So the first thing I'm going to do is go up to my surgical history and click on it. There are two ways I can add this. I can simply click Add. Now, if I know the date, that's really nice to have. It's not required, but it's a very nice thing to have. So that's one way. The other way is I can have this keyword box here, and then I can click on the ellipsis box here, and I can search for it. In this case, I've got all of my favorites showing. And it looks like I don't have that one shown as a favorite, so I'm going to uncheck this, and now you can see all of them, and I could either scroll through to find it, and there's cholecystectomy, or I could search for it and find it either way. Now in this case I've added it twice. I realize that doesn't quite make sense, but those are both ways that you could add it. Also, if I knew the CPT code for cholecystectomy, I could add it that way. If I click CPT, click the box, then I could search for the code. I don't know the code for cholecystectomy, so I'm not going to add it that way. Now, this is in my surgical history. I'm going to go ahead and erase one because I don't need both of them in there. Now it's in my surgical history. Finally, we need to remove this from the problem list because the patient no longer has gallstones, and they shouldn't ever get them again because they don't have a gallbladder. So I'm going to go to their overview, and here you can see the problem list. Notice gallstones are on there. Well, I want to save the information that I've done and move it all at one time. So I'm going to click on the ellipsis button, and I can see my medical history off of my problem list. Notice here's my notes, still there. I'm going to highlight gallstones, and in this case I'm going to click Remove. There is this Copy to Medical History button, but that will put it in two places. Instead, we click Remove, and it'll give you the option. Do you want to just remove it? Or what's recommended is remove it and add to the medical history. That's what I want to do. I remove it, I add it to the medical history, all with one click. Now, if you look on the medical history, we can see gallstones. It's still on the problem list for today, but once I lock this note, gallstones are no longer going to be on the problem list. In this way, I have now documented gallstones at my first visit. When I see them in follow-up after the intervention, I can still document the follow-up, and I can document the surgical history, and I can move gallstones to the problem list all at one time. This is the recommended action for any medical specialist or primary care physician who's performing an intervention or procedure, especially if it results in the diagnosis no longer being appropriate to be on the problem list, but it should still be listed as part of their medical history. Another example might be someone with tonsil stones. Once they've had the tonsillectomy and it's removed, they no longer have tonsil stones, but I would like surgical history to show tonsillectomy, and I would like their medical history to show the history of tonsil stones. Hopefully this was clear for you. I would also recommend in the assessment box that you take advantage of this notes box. In this example, I've also added a diagnosis of coronary artery disease. Even if a person's had a bypass graft, they're probably never considered cured of coronary disease. So this is a really nice place that I can add a running commentary. So I might put the initial visit, coronary disease, scheduled for stress, echo, and then when I see them back in 2 months, positive stress, echo, had bypass graft surgery with Dr. Jones, and then I can add another visit, normal stress test. And this is something that you can just add to at every visit, and that can be quite helpful for those complex patients where you need to keep track of what has been done and have I done this before. And these notes will remain there unless someone removes them. That also raises the question or the point that we work in a large multi-specialty group. If you add or remove something, you have added or removed it for everyone. If you're the medical specialist taking care of that problem, please add or remove or update that as appropriate. If it's something that you don't deal with or don't have involvement in their care, please just leave it alone because some other specialist in our group is taking care of it. Hopefully this has been beneficial for you.